So hi everyone, thanks so much for joining us today. My name is Gina Chumesi, as always, psychiatric APRN, where I do these videos to really hopefully bring or destigmatize mental health overall, especially in our Black and Brown communities, in our immigrant community, so to speak, because I'm an immigrant, as I always say. So if this is your first time joining us, thank you so much for tuning in. I hope you find this video helpful. If you're a returning listener, thank you again so much for supporting me. Today we are doing a special segment and focusing a little more on our women. And I'm super excited because anything pertaining to women is my niche right there. And I am joined by no other than my powerful friend, colleague that I admire so much, Dr. Lucinda Canty, who actually used to be my professor. So it's always so great to have her. And I was looking on Twitter a little bit overnight, just trying to get really accustomed. Once again, it's been like a year or two since we met. So I was like looking over your credentials, and I just want to put it out there, Dr. Lucinda. You are a mother, you are a nurse midwife, you are a nurse researcher. Really awesome. I really love that. You are also a professor, like I mentioned. You were used to be my professor, and you touched my life so much. Some of the stuff I'm doing right now is because some of you guys have paved the way, and I really look up to you so much. You're a Black feminist. Where's my stuff here? There's more coming. Reproductive health justice activist, an artist, and a poet. I didn't even know you were a poet. I just discovered that. That's so amazing.
So, one of my favorite things.
Yes, awesome. I can't wait to maybe one day be able to read some of your poems. So today we are going to be discussing or actually not discussing, we are going to be debunking some myths about reproductive health. And just when I'm ready, it's going to run away from me, but it's not going to run. I'm going to pull it right back. Hold on one second. Sorry about that.
That's okay.
Let's see. I'm just going to research it. There, found it. I'm like, what? There's nowhere I can lose it. So we're gonna dive right in. Are you ready, Dr. Canty?
Yes, I'm ready.
First question is, and some of these questions come to me from the younger ladies. I've already have my 2 kiddos out of the way. So, but from your, you're such an expert in this field. I'm like, I don't know. Some of them I might know, but some of them I'm like, no, I'm going to leave it to an expert, and I'm going to use this platform to put the word out there. Okay. So it says your baby bump disappears like within a few days or a few weeks after having a baby. Is this true? Can you help us?
Well, yeah, so and that's a common question, because women are, once they're pregnant, they think once the baby is out, their stomach's going to go back to being flat. And it depends on the woman. It depends on how she was carrying, how like women who their muscles pull the baby close to their bodies don't have as much stretching. And some women are rounder, we say rounder, that the baby is more forward and not so much resting on their back or have that support, especially as women have more children. Okay. So after delivery, because your stomach has been stretching for because the first 4 months, you don't see as much stretching. After that, the baby grows so quick. Right. But because it's been stretching over time, it takes time to come back. The uterus, even itself, it takes 2 weeks to get back to its pre-pregnancy state. So again, like sometimes people think the baby is out and my stomach is going to go flat. but it could take up to 6 weeks for your abdominal muscles and everything else to come back.
Right.
But also, it could take up to a year. So it varies from person to person.
Yeah. It's been over a year for me, and I'm still like, I can't use that excuse anymore. So I gotta start working on it.
Yeah. But your body tries. Your body tries.
I know, it tries to help us out, but sometimes I think we just also gotta, after, especially the year, to do some ab work and stuff like that.
Yeah. And nutrition is very important.
Wow.
Sometimes women, it takes time for your appetite to go back to normal. So sometimes women are still eating like they are pregnant initially. And then if you're breastfeeding, you're eating more. So you have to be careful about what you're eating, because you do need the calories, but the sugar and the fats, they make, again, the fatty tissue go back to normal. It makes that take longer.
Right.
But the other piece is birth control. Birth control pills, the shot, the implant, everything can make your appetite more. Right. It doesn't make you gain weight itself, but it makes you have those cravings. And we all know, if you don't get your cravings, the more you want it, and then you binge when you get it.
Right. Oh my, that's such a good point. That's such a good point to have that discussion with your OBGYN about options for birth control, especially if you started, you notice it's just making your cravings higher, to see what other options could be, because there's so many options now too. Such a good point with nutrition, because sometimes we don't think of it like that. We focus on the baby and what the baby needs, and as mothers.
Yes.
So next one is super interesting. And many women will feel very hesitant to ask this question, but I threw it in there because it's super important. JJ, without this is hopefully adults only listening to this, but our vagina becomes loose after having a baby. Does it come back to normal, to the pre-baby size, or does it stretch out?
Yeah, it does stretch. It does stretch to accommodate the baby's head. The muscles the hormones during pregnancy do make the muscles a little more relaxed, so that they could stretch to accommodate the baby. And when the hormones are out of the body, it does help for the muscles to get back to kind of where they were before. It's never 100%. Women who have cesareans are kind of saved from that. Women who have vaginal deliveries, and then if you add on that they had tears, that can have an influence. But there is something that women can do that they can start doing before the pregnancy. Because I always say, we call them Kegel exercises.
Oh yeah, please.
Yes. And if you listen to Cardi B, she talks about the Kegel muscles. They're doing Kegels here and there.
Yeah, that's true.
So what it is really just tightening the muscles and relaxing them, and doing it throughout the day. Because if you get those muscles strong before, it makes it easier for your delivery and for them to come back to normal after. And you can really do these anytime. And what Kegels are like, if someone is urinating and then they try to stop it, those muscles that you use to stop it are the ones you want to strengthen.
Right.
So they can help. And just for women to know, your body will, again, it needs time to heal. Sometimes having sex too soon can interfere with that. Sometimes if you have a problem, like let's say you have itching, or not itching, but like pain in the area because of the delivery, and you don't have it examined, it could become an infection. Right. So you have to make sure that you take care of your body. Right. But the vagina is very forgiving. It's very forgiving.
Good to know that's very forgiving. It can come back, with some help to the normal.
Yes.
Size. But do you think this is just a by the way question? Sure. One or two of my girlfriends were talking about this the last time. Does douching help? Do you encourage douching to get like stuff out of the tube there, or
no douching? No douching.
I said no.
Yes.
That's what my OBGYN told me. Said it just cleans itself.
Yes. And sometimes women don't like to have any discharge at all. And
Right.
just a minute to talk about discharge, because women, especially women of color, we don't like to talk about our vaginas, our
Yes,
VJs.
we
We
gotta
don't like
talk
to
about that
talk
for
about this.
KJ. Real talk.
Yeah, but discharge is normal. It's
Yeah.
normal. It should be white. It could be a little grayish in color. On the underwear, it could dry like brown.
Yeah.
As long as there's no odor, as long as there's no irritation or itching, that's normal.
Right.
If there's an odor, that could be an issue. We worry about bacterial overgrowth or bacterial vaginosis. If it's itching, we worry about yeast.
Yes,
And they
right.
both could be very uncomfortable.
Correct.
But sometimes women have that normal discharge, especially after the period, is a little heavier because your body's trying to get rid of, the excess cells that came out because of the period.
Mhm.
But as women, we don't like it. So we douche, and douching is putting solutions, different solutions into the vagina to flush them out.
Right.
Sometimes people use vinegar. I heard apple cider vinegar, regular vinegar. There's something else, baking soda, and even someone who used boric acid. You have to
Yeah.
be very careful because it washes out all the good cells. So the
Right.
cells that help regulate your pH get washed out, that if you had a yeast infection or bacterial vaginosis, it'll come back stronger.
Stronger.
Yeah, and then it's always hard to get it back to
Right.
normal. It takes time
Yeah.
for that.
Yeah. So it probably can put a lot of women prone to more frequent
Yeah.
bacterial infections, correct?
Yes. And because again, your body needs to have that balance and it knows what to do. Sometimes it doesn't happen as fast as we want, but it knows what to do to kind of clean itself out and balance it.
Right. And I think
Yeah,
sometimes even we don't think of it, but even taking a bath more frequently
yeah,
and having those chemicals in the bath water go
yes,
from there,
yes,
right?
yes. Oh my God, bath bombs. That
Yeah.
was a big one. I can't tell you how many women would come in with itching after. They'll say, because I asked, is there anything different that you did? And they'll say, well, somebody got me these bath bombs for my birthday, or I saw them in Marshall, so I bought them. And they're okay. But the only thing is sometimes they're loaded with chemicals
Chemicals, yeah.
and they're good for other parts of our body, but the vagina is also very sensitive.
Is it right. Yeah.
Yeah.
So that's really good to know. I know some women who
Mhm.
even want to douche after each sexual or
Yes.
like intimate encounter with their partners because they feel
Yes.
like,
They need to clean themselves.
oh yeah, just water, I feel like should
That's
be.
it. Just water, and no soaps. Like sometimes people use a lot of soaps. I think they kind of calmed down, but Victoria's Secret had all these different types of scents and lotions,
Mhm.
body sprays, and people would put that on their vagina, and it causes awful infections.
Yeah,
Awful infections.
yeah, because if you take care of it well down there, it really should not
Yeah.
have really bad smell for your partner to feel that
Mhm.
something is cooking down there. So it's all about frequent self-care
Yes,
and
yes.
cleaning of the chemicals. So this is a
Yeah.
really good point. Really, really good to
Yeah.
know.
Yes, leave your vaginas alone.
Right? Yeah. Our next question, I think we might have touched on it a little bit. Does breastfeeding help us lose weight?
Yes. Breastfeeding, you burn a lot of calories, a
Mhm.
lot of calories. Sometimes though breastfeeding can make you, because sometimes you feel hungry, like your body is telling you you have to eat, especially if you're breastfeeding around the clock and that's
Right.
all you're doing is exclusively breastfeeding. But because sometimes you can get that craving or that desire to eat, just be careful of what you are eating. Because
Mhm.
sometimes as moms, we're busy, we want something quick, we want something fast. So we have to make sure that we're having anything green and leafy. Certain proteins are good. You just want to be careful with the sugar and anything that's like fried and
Right.
heavy.
Yeah.
But we're even seeing that babies could respond to what the mom is eating. So things that could give the mom gas, we see in the babies have gas.
That's too
So you
right.
do have to watch your diet. But you
Right.
can lose. I can't tell you how many women, like they're breastfeeding, they lost their baby weight. And then when they stop breastfeeding, they're like, I'm getting my weight back.
Comes
Yeah, but
back.
they're not, it burns a lot of calories, a
Oh
lot
yeah.
of
Yeah.
diabetics. It helps your glucose stay in check.
Wow.
You know, if you had gestational diabetes, you know, you do go back to normal after delivery, but the
Yeah.
breastfeeding helps to, you know, your body to get back to normal.
Right. So you can kind of use that as a stepstone to actually continue. So it's really good for women who are listening in today to know that, you know, once you breastfeed and you lose some of the weight, you can just kind of step off of that to continue.
That diet.
If you relax, then you might truly get the weight right back on.
Yes. Yes.
So that's really good also. Next question is, can a woman have sex right after childbirth?
Yes. The answer is yes. The answer is yes.
Okay.
But I have to say, but you have to keep in mind that pregnancy can still happen. Women can ovulate as soon as 2 weeks after delivery. And I've had women who they've had a long labor. They're like, I'm not having any more kids. And then they go home and they have sex. They have sex before their 6-week checkup.
Right.
Yeah, because I think there's a mix of things. One is our hormones kind of shifting and going back to normal, but also you have this cute little baby. And so your partner and you, it's just like everybody feels good. And we know when we feel good, we like having sex.
Right.
So yeah, and I've had women that they tore and had to get, you know, stitches, they had to get cut, and they still have sex. So my only thing is to be mindful that you could get pregnant, but also if your body did have tears, you can cause damage to that.
Yeah.
So even though you can do it, you can still have the desire. It's important to see where you're at in your healing process. And as long as you're not hurt, you're not uncomfortable, you can have sex.
And make sure that if you're not ready to be pregnant again, to take measures so that you don't get stressed out and freaked out by finding out, and then that's more stress. And we talked about postpartum depression the last time, and that can kind of have that cascade effect. I feel like.
Yes.
So talking about postpartum depression, does every woman get postpartum depression?
Oh God, that's such an important question. And I think there's variations in like the mood, because just imagine that someone is carrying a baby for the 9 months. And I'm just using someone who had a full-term pregnancy. And you have that baby. And I feel like during pregnancy is like that time where you're the only one that feels those movements. You know, people could put their hand on the belly, but there's nothing better than feeling something growing inside of you. So there is that attachment. And when the baby is born, it's like women miss that. You know, I was one of those because I used to love feeling the baby moving. My son, he's taller than me right now. He's only 12. But I used to even after I had him, I would sometimes reach down for my pregnant belly, and I'd be like, "Oh, you have the baby."
It's not there anymore.
Yeah. So that's one thing that women I think are adjusting to, is that kind of a detachment from not having anything growing inside of you. And then as you're shifting your hormones. And again, this doesn't always contribute to depression, but it does impact your moods. That you have some sadness. You know, some women describe it like, I'm watching television and there's a commercial showing a baby running and I get emotional. Or I see a loving moment on TV, I'm getting emotional. The only thing with that, and we call it the baby blues. Yeah, and the thing with the baby blues is you're still doing for yourself. You're still taking care of yourself and your baby. And then there is postpartum depression. That could be the other shift. And there's so many factors that contribute to it. Women who had maybe an issue during the pregnancy or stress during the pregnancy. Someone who delivered early, you know, their baby's in the NICU, or they suffered a severe complication. This is something I'm learning more about, like women who had preeclampsia, you know, their blood pressure was through the roof. You know, became very sick.
And now have good support too after the birth of the baby. If your partner becomes very busy, they're back to work, and it's you and the baby, and you had all these complications. When the baby comes in,
and also women who all the attention is going to the baby. And I'm not saying this is a single cause, but if you're already having trouble with your emotions and feeling worthy to everyone else, to feel like you are important, but all the attention goes to the baby. So if you're already coping with that, you're feeling like, well, if I'm not here, nobody's going to care. Everybody cares about the baby and
Right.
nobody cares about me.
Right. Yeah.
So I'm
Right.
just saying, like, if someone's struck, not that that happens to everyone, even though there's some moms that get jealous of the baby because everyone is giving attention to the
Right.
baby. The mom's like, hi, I gave birth to the baby
Right. Yeah.
and nobody's paying attention to me.
I come over
But
here.
yeah, but if you're already having some issues with seeing, even just adjusting to a mom, those are things that can make it, if you don't have that support, kind of make, the symptoms of depression kind of come to light. And if
Yeah.
they're not taken care of, the symptoms will only get worse,
Right.
only
Yeah.
get worse.
Yeah.
And if you're not getting enough sleep,
Oh,
because
yeah.
that's a hard thing for everyone. But if you have a partner, like for myself, 2 weeks after the baby, his father went back to work and I'm home. So I'm doing everything. I'm not sleeping at night and then I have to stay up all day. When
Right.
you get very tired, those are all things that impact your emotions.
Happy emotions, yeah, and
Mhm.
especially in our communities, we don't, we just kind of, have to be strong. Your mother
Yeah,
did
yes,
it, your
yes.
grandma did it. I mean, I
Mhm.
remember my mom had 6 of us, and when I had just my first child, and I'm like, wow, every hour, every 2 hours, what? This is what every woman
Mhm.
goes through. I was literally
Yeah.
like strapped. Nobody prepared me for
Mhm, mhm.
that. And
Yes,
my
yes.
partner's back to work, my partner will be like, I need to get some sleep because a lot of men cannot multitask maybe like we do, or society also has
Yeah, yes.
conditioned them to
Mhm.
have, that's a whole different conversation.
Yeah, yeah.
But
That's the mother's job to get up
yeah,
in the middle of the night. And especially if you're breastfeeding, you can't even be like, oh, here, make a bottle and feed the baby. You're the
right.
one that's doing the breastfeeding.
Oh, because the baby has to be you, and that's where it really kind of relaxing the rules. If the baby falls asleep
Mhm.
while there, of course, safely so, it's okay. Just don't have to force
That's
yourself to get
how.
up, put the baby in the crib, come back, and then that can disrupt your sleep. You're coming back to
Mhm,
bed, baby wakes up again. You're like, oh. Sometimes baby
mhm.
just stay warm in your corner. Then you can get maybe 2 or 3 hours and feel a little more restful than try to be maybe
Mhm.
perfect, especially
Yeah.
first time mom.
Yeah. And that's another piece of this too, our mental health and well-being is we want to be strong. We want
Yeah,
to show everyone that we could do it because we
yeah,
don't want someone to be like, oh, then you shouldn't have been a mother, even though no one would hopefully would dare to say that to us. But that's
yeah,
sometimes how we feel. We don't want anyone. And even when you start having feelings of depression, sometimes you don't want to tell anyone because then
yeah.
you don't want to be judged. Oh, she's not a good mother because she's not, because it always goes back to, you're not taking care of yourself. That's why you're feeling that way.
Right, right.
Yeah.
Yeah.
So we have to have the support.
Good point there, to have the support, to self-care,
Mhm.
because if you don't take care of yourself first, it's hard to that
Can't
baby.
take care. Yes.
Yeah,
Mhm.
yeah. Can we have kind of mother, you've had C-section before, like myself, I had C-section. I was trying for natural birth. In my case, it just didn't work out. But have you had cases where moms can have C-section, have successful natural birth after? Because some people get
Yeah.
disappointed. I was so disappointed because it just changed my birthing plan. And even
Yeah.
that, I have to be honest, it cost me a lot of sadness, a lot of, maybe I'll even say, looking back now, hindsight 2020, like I feel like I had some depression from that because I
Mhm.
had this plan for what I wanted it to look like,
Yes.
and everything was just like, because my baby ended up in the NICU. This is why I have passion for this, because
Mhm.
I was just thrown off. And
Yes.
I
Yes.
had like, oh God.
Yeah. Yes. Yeah. No, I know exactly what you're saying. And even for myself, I had a C-section.
Mhm.
And it was hard. I knew I had to have it for my son. He was having some distress, but there was a part of me that even before I even became pregnant, I always had this dream of pushing my baby into the world. Like I would push it out and I'd be like, oh, I did it. And then someone would hand me the baby. And
Right.
when you have a C-section, that's taken away from you.
Yeah.
And I've also talked with women who had like two C-sections or more, because
Mhm.
when you have that first one, it still depends on what happened that first time. If it was like your blood pressure, if it was, the baby was in distress, then there's still that chance you could pass and deliver your next baby naturally. But if
Right.
your pelvis is small, or there was some issue that prevented that from happening, then the doctors, or even the way they do your C-section, because sometimes the way they cut your abdomen, you can't have a vaginal delivery because your body couldn't handle the contractions to go through a labor. So I think I always tell women, please, with your first pregnancy, make sure you understand why you need the C-section, but also, ask if you become pregnant again, could I have a vaginal delivery?
Right.
That could be hard.
I think a lot of providers, maybe things have changed since I had my kiddos, but I feel like they should really have that discussion. Like, you have the birthing plan, but just so you know, it can change. And these are the potential things that are common that you could potentially be faced with. Preeclampsia is so common. A lot of people don't really talk about it. I had preeclampsia. I've had numerous friends who've had preeclampsia, but a lot of providers don't just prepare you, like, potentially you can have this, potentially this can happen. So if that changes, this is how it's gonna look like. So you can do your research, you can prepare for plan B.
And that's so important what you're saying. First, have a birth plan in the first place. Develop your birth plan and make sure your provider knows. So your provider should also say, look at your birth plan with you, say, these are things that you can do. This one, I'm not sure because, there's something going on in the pregnancy, but also they should say, if there's a chance of an emergency, we may not be able to do this. But I think that's so important. And I find that with women, so your first one, the next pregnancy, you can have a vaginal delivery. After that, you have to have an appointment. I don't want to say you can't, if you have 2 C-sections, I don't want to say you can't do it, but you have to talk to your provider about the risk, because they're saying after you have that second one, the risks are extremely high. For you to have to rub that incision to rupture. That's really the greatest fear that we have. I had a patient and I didn't agree with this. She wasn't actually even my patient. I was just caring for her. She was seeing someone else. She had 2 C-sections and her doctor told her, no, you're not going to have a third one. I mean, a third that you can't have a vaginal delivery. So what she did was she waited till the last minute, then she went in. It was too late for them to stop it. And she had a vaginal delivery with no complications. But our fear is that it will rupture. But I feel also, if you're talking to your provider, like, no, you can't have a cesarean, ask them why. I had someone who reached out to me. I think they had 2, maybe even 3 cesareans. And they wanted to know, and their doctor was like, no, we can't do it. And that's not enough. We need a little more information. So when I ended up talking to her, it turns out the type of incision that she had, she was very early when she had that first cesarean, but that incision, we call it classical. Instead of doing like the bikini cut, she had her uterus cut up and down. So that one, they don't even want you to make it to your due date. So, but then when I talked to her, she was at peace with that. But her provider didn't want to have that discussion. She's like, no.
Mentally, she's prepared for that. But those cuts, are they still a thing?
They are. It's usually an extreme emergency when they have to get the baby out. And I've seen it more common with preterm babies. So because they don't want them to have to squeeze through that small opening. So it's still out there. The providers try their best to avoid it because they are worried about that next pregnancy and the risk. But they should explain that to the mom so that she knows.
A few percentage of women, I must say, and once again, I could be wrong, but have birthing experiences that are like the classic book type, nothing really goes wrong. In that case, the provider, even if you're not giving it, there's nothing really information together because everything is just like falls in place. But where there's this kind of unplanned emergencies that happen, I think it's very important for providers to really take a minute. I know it's a very fast-paced practice sometimes. You're in and out. Sometimes you see a student or, it's very scary for especially if you're young and this is your first time and you don't have a lot of good support.
But that's another important issue is that when you're in the hospital, people, because I know people who go in the room and check a mom, they don't even say their name. So
Oh,
who are you before you even do a vaginal exam? And I
yeah.
know sometimes students are learning, the student should still be introduced and the mom should still have a choice if she wants a student or not. And
Right.
yeah, and don't have, because I heard of this situation. There was a student that was working with a mom, and three doctors, I think they were residents, came in, and all three of them are checking her.
Yeah,
And then they still don't know where she's, how far dilated she is.
right.
So I'm like, have some respect for her body.
Yeah. It's,
So, and
you know,
yes,
in the
and
healthcare system, you don't even
yes,
know who the attending is, who the residents are,
exactly.
because everybody just come in. You think, what are, are they communicating?
Yes. I even had and this is not, well, it was funny at the time because I laughed with the mom that told me this. She wasn't my patient, but she said that someone came in her room and and she was like, "Are you guys going to check me?" And he was like, "I'm just here to empty the garbage." He didn't even have nothing to do with
That's
it.
not good.
Yeah, because so many, she was used to people just coming in and she didn't know who they were and being
Yeah.
too shy to ask.
Too
And
shy.
after that, though, then she was like, "Who are you?" when they came in.
Yeah.
But it's so important.
Can you
But the other,
imagine? Yeah.
yeah, but the other thing is with most, there are emergency situations when
Mhm.
everything is going good and then it could be a crash. But sometimes the doctors see things or the midwife, they see things
Right.
and they are thinking, I'm going to keep an eye on this mom, but they don't tell the mom.
I
So,
don't know.
and it's because I think it's more traumatic to come in the room and say, we got to do emergency C-section.
Yeah.
We're going to put the catheter in you and then everybody's moving fast. But if you say, you're doing well, but, I want to keep an eye on the heart rate.
Yeah.
I think that decreases anxiety.
Oh, totally.
Yeah. And then, you just prepare her,
Yeah.
your blood pressure is going up. We're going to try to see if we can get you this vaginal birth. But if your blood pressure keeps going high or something's going on with your heart, because preeclampsia impacts the liver, the kidneys, everything.
Hmm.
So if they come in, they say, just, keep the mom and, let her know what's going on and say, we're keeping an eye on your blood pressure. We are concerned, but you're doing good right now. The baby's doing good. But
Right.
just know if your blood pressure keeps going up or we're worried about you having a seizure, we're going to just do a C-section and deliver the baby.
So
Just prepare it if you can, because sometimes things happen really quickly, but
Mhm.
sometimes there's like a suspicion that you have that there could be something. You don't want to scare the mom, but give her some information that you're just keeping an eye on them,
Oh yeah. I mean,
so she's prepared. Because
it's
if they
very
have this, yeah,
scary when they come in and let's say something is changing, they're seeing it
yeah,
on the monitor outside of the room. Because like my
yeah.
experience, they were seeing it outside,
Mhm.
right? Nobody were really coming in to give me heads up. And I don't know what's, I hear the beeps, there's a lot of sounds, different beeps going on, and that's not my area of expertise. So all of a sudden, all I know is like bunch of people just rushing in on me. We were like, what's going on? Because I didn't know it was,
Yeah,
they're like moving the bed. I'm like, what? Can somebody just talk to me?
yeah.
It's like, we got to go now. It's
So,
like telling my
yeah.
husband to go outside, my mom to go. It's like, oh, it's a very chaotic,
Mhm,
like,
mhm.
I know they're trying to save, my life and save my babies, or in this case, whoever in that situation.
Yeah.
But I think a little heads up for the mom to
Yes,
know what's
yes.
been going on. So,
Mhm.
it's not so like, God. And then I remember when they did that and then they put the mask on me. I can't remember what, before they gave me, I think it might be propofol or whatever they gave me. And, the oxygen, I'm still,
Yes, yes.
awake, but I literally felt like I was kind of dying slowly. And
Yes, yeah. Oh my God, yes.
and the
And that's what,
guy, they were
mhm.
giving this resident a chance for him to practice doing, what's more call it, the block, what is he called?
Oh, the epidural.
Epidural.
Yep.
And
Mhm.
each time he doesn't know how to do it, but each time
No,
he did it, like, I swear to God, like 5 or 6 times before the attendee came over, because I'm like, I can't take it anymore. I felt like I
unacceptable.
was being like electrocuted and I was
Yes,
shaking.
yes.
I was
Mhm,
feel like I was
mhm.
seizing. And then I felt like I couldn't breathe because the mask was like
Mhm,
suffocating
mhm.
me.
Yes,
And I didn't have any family member with me. I was so
yes. No, no. See, that's unacceptable to me because,
yeah.
and I know people are learning, but at the same time, they have to look at your well-being. and what you're going through. Because the spinal cord is nothing to fool around with. Nothing to fool around with. You know, I was watching this, there was this news broadcaster that shared her story, and she was saying how they did it was a student doing the epidural, and she was like, she had a question. They were like, well, they have to learn. So they went along and proceeded, and the anesthesia went up too high. And she was even trying to tell them, I can't breathe. And they were like, oh, just relax. And she was like, no, I can't breathe. And then they realized it was an emergency. She blacked out, but they were able to, because so a nurse was like able to kind of jump in, and they started working on the mom, and she was okay. But they have to realize the risk. And if there's that risk to the mom, how about, you know, you step back and let somebody else do this so we can tend to her and tend to the baby.
There are a lot of cases, you know, moms, especially I might say like minority community or Black and brown, who will lose moms in these situations, because sometimes there's those, you know, colorism even in those areas, because as soon as you show up, or you know,
they assume, they think they know everything about you.
Exactly.
That's a problem, and that's one of the things that I'm really advocating for, is for women just to be treated as human beings. You know, if we're in pain, we're in pain. If we're nervous, don't tell us, shh, just relax. No, find out what's going on and give me the answers that I need. It's just as simple as that.
Yeah, as soon as you show up, but there are times where I have to throw my you know, my nursing card, like, by the way, you know, I don't, you know, I see XYZ, but I'm a nurse and I know that this is things that's then, you know, every, you know, the dynamic changes right away. Every the approach, the conversations, like, change. You know, the team that you're a nurse or you're, you know, so because as soon as you come out, a lot of times all they see is color, and they put you in a certain
and everything that they want to, their implicit bias, everything they believe about it, that we don't care, we exaggerate our pain, you know, we give them information they're not going to understand, to even that they don't read or write. I had a student that said that she showed up to work with a nurse, and the nurse was like, do you know how to read? No, I can't, sorry, I shouldn't be laughing. You know, I was laughing because I couldn't believe it. She's a grown woman in the nursing program, and the person was like, can you read? Do you know how to, do you understand English? And she was like, oh my God. She was like, this is unreal. So, but, you know, but it's like, that's sometimes how they see us. And it doesn't matter our degrees, how much money we make, where we live. You know, because, you know, I'm just going to throw it out there. If somebody comes in from Glastonbury, you know, someone who's white, you know that, oh, we're going to be on our best behavior.
It's different.
You know, that resident that's going to practice on somebody's epidural on someone's back, she's not going to see them.
No.
You know, they're going to let her know, oh, look, we know we're keeping an eye on the baby. Like, all those things change. Is a very sad reality of our healthcare system. But that's what puts a lot of women of color in danger.
At a disadvantage even.
Yes. And pregnancy is not the time. During pregnancy, childbirth, postpartum, those are very vulnerable states.
I mean, I remember not just my story, and this had, you know, pushed me to do some of the segments on mental health and women and fertility. You know, I have another one on fertility treatment in itself, like IVF, IUI, and how that impacts, and how that in relation to African-American women. But I remember time and time when I was pregnant, you know, I kept gaining weight. I wasn't eating, actually restricting my diet because I didn't know what preeclampsia was. My doctor, I'll go in, she's like, oh yeah, you're just eating too much. I said, how many times? I am not even eating. He's not taking a minute to listen to me. He's like, oh, it's summer. It's probably because it's so hot. You're gaining so much weight. And the medical assistant probably doesn't know how to check the blood pressure with the cuff, because she's listening. She doesn't know. Every time she's like, oh, 120 over. if I knew what I know now, I'll probably go get my own blood pressure cuff. I have never heard of preeclampsia until the day that I was transported to the ER from work. And thank God I was at work that day. And I was just like losing it. I was losing consciousness. And I was throwing up. My colleagues were like, Gina, you need to go to the, I'm like, oh no, I'm just stressed out. If it was a minute or two longer, I would have been gone. My daughter would have been gone because I was rushed in an ambulance. But when I look back, the MA probably over a course of weeks or months was not checking my blood pressure right. The provider or the doctor, the MD on my case was not listening, was just brushing me off. For whatever reason, you know, biases or what, it was just awful.
Instead of looking at and evaluating your symptoms.
A little more.
It doesn't hurt. And and it doesn't hurt at all. That's the problem. That they don't take the minute to just listen. Say, you know what, you're not eating. It's like I had this patient who came in who gave me her urine samples, only a tiny bit of urine. And I was like, did you just go? And she's like, no. She was drinking fluids all day. So I'm like, something is going on. Her blood pressure was through the roof. So I end up sending her over to be delivered. But it's like those little pieces that you have to put together. And think, I could have easily said, oh, well, she went to the bathroom before she came, and that's why I only have a little bit of urine. But sometimes it just takes a minute. I'm very old-fashioned in nursing. I want to go back to when you touch patients, you listen to their heart, you check their blood pressure, that you get a history, get a history first. But we just went away from that when people come in, we know more about their bodies and what they need than they know.
Right.
And that's how you get into trouble. That's how you get into trouble.
Yeah. Tailor each patient's presentation to what they are needed rather than just making it one big
exactly. And just take a minute that if someone has a complaint and, because I had a patient once who was like, oh, I feel a baby moving. And she was on birth control. And I'm like, in my head, I'm like, there's no baby in there. But I said, but that's her body. I said, she's feeling movement. I said, maybe it's some gas, but let me check. And it turned out she was 8 months pregnant.
Oh, Lord.
Yes, wow. She told other people and nobody listened to her. And I just said, let me just do I'm just like, let me just, at least let me check. And I can say, look, we checked, you're all right. It's not a baby. But when I put my hand and I felt the baby moving, I was like, oh goodness. And, we did a pregnancy test. But still, it just takes a minute. For me, it was a lesson learned.
1 minute.
Listen, people know their bodies. But I could have put my hand on her belly, could have been soft. Maybe she had gas. But at least for her, she felt comfort, because I had other patients this happened to, and there was no baby. Right. But they felt comfort that I listened to them and I checked.
You checked?
It only takes 5 minutes.
It takes 5 minutes to just make that extra move to check. So now that we're, talking about all these possible complications that can happen, let's say a mom who has a baby after, all this stuff that's just kind of outside of her birthing planet.
Yes.
Is it common to maybe not feel like you love baby right away, like the first few days?
Yes. And that can happen. Yeah. It can happen. And the extreme cases when there's not a connection with the partner or there's other issues going on. But sometimes there's no pathology. Everything is fine. But it's almost like how in the movie they see the baby and everybody's in love. Even if they were like, I don't want a baby. And then they see the baby, they're in love. But in real life, sometimes that connection doesn't always come, not right away. It does come, it does develop. But sometimes it's not like love at first sight. And I hate to say it that way, because they still love their baby, they appreciate their baby, but they don't feel that warm and fuzziness.
Right.
That, that mom who like, even her baby winks, they're like, oh, I got to get to the baby. Right. They may not have that at first, but sometimes it does develop.
Right.
But I always say we got to investigate too why they feel that way. Because I've seen patients that had trauma in the past. Yeah. I've seen patients who are in very violent situations with the partner. And again, those are the extreme cases, because there's women that had none of that. They have a loving partner and they still don't feel that right away. They
Yeah.
don't say it. Like a lot of women won't say it till later. They'll be like, when I first had my baby, I was kind of like, I didn't feel attached. I didn't really care, and
Yeah.
then, but it changes. That's like a relationship developing.
Yeah.
But a lot of women won't say it because they're afraid that people are going to be like, oh, you don't love your baby. Something's wrong with you.
Yeah, yeah. What kind of
Mhm.
mother can you be? To set
Yes,
pressure
yes.
on this whole motherhood
Yeah. But it's more common, I
culture.
think. Yeah, it's
Yeah.
more common than we think.
Mhm.
But
Definitely.
again, the attachment does come. It comes, sometimes it just takes a moment for that to
Okay.
happen.
Yeah. So if you're listening
Yeah.
out there, just hang in
Yeah,
there.
yeah.
Comes.
Mhm.
And same thing with, next question being miscarriages.
Oh,
What
yes,
if that
yes.
mom had a miscarriage before, depending on how
Mhm.
far the
Yeah,
pregnancy
yes,
was
yes.
before a miscarriage, or even moms who have stillbirths,
Yeah, traumatic,
that's
traumatic.
yeah, I remember, once again, I will use my story as an example. I between my two, I had a miscarriage, but I kept it hush hush. It was those pregnancy miscarriages that's they call it unexplained. You had a good pregnancy going, all of a sudden there's no heartbeat, you get totally
Mhm.
devastated, you get depressed even,
Yes,
we don't
yes.
talk about those. But I remember going to work. I was in the break room talking to one of my girlfriend. They were somehow talking about miscarriage, and one of them had gone, and I said, "Oh yeah, me too." And the other person was like, "Oh yeah, me too." And we're all going like, "Oh, I guess all of us had experienced."
Yes, yes, because it's more common. They say like 1 in 4 could end in a miscarriage. And that's pretty high. That's pretty high.
One in
But
four,
I'm
right?
glad
Yeah.
you're bringing this up because any loss has an impact on the mom. Sometimes people are like, because I have patients that would tell me, I had a miscarriage and people said to me, oh, don't worry, you could get pregnant again. Or you're young, you can have a lot of babies, you're gonna have lots of babies. And that kind of almost like causes trauma to them because you're trying to understand how they're feeling and to have someone dismiss it. So it's traumatizing.
Mhm.
So it's important to know that whether it's 4 weeks or because we say up to 20 weeks is considered a miscarriage. Any
Right.
any pregnancy loss after that's considered, before that's considered a miscarriage. So
Right.
it's like any stage of pregnancy, and when we're looking at stillbirths, anything beyond the 20 weeks, it
Right.
still has a very significant impact on the mom. And we have to take a minute and make sure we acknowledge that and we check in with them and make
Mhm.
sure that they're okay.
Right.
But the other thing is once someone does have a miscarriage or some loss, ectopic pregnancy, miscarriage, stillbirth, in their next pregnancy, they're bringing some of that stress and anxiety.
Mhm.
Because like you said, there's that case where the mom's at home, she starts having pain and bleeding, and then she knows that there could be a chance she's losing the baby. She doesn't
Right.
want to, but she feels it. But
Right.
there's that other case where they're feeling fine, they go in for a checkup, and the doctor's like, I don't hear a heartbeat.
Yeah.
And then that's like, it's like she wasn't expecting that.
In that,
So
right?
to carry that every single visit you go in, you have those feelings.
Yeah.
And it doesn't, like, people think, oh, you're going to get over it quick. It's not a quick feeling that you get over. Some people,
No.
it stays with them a lifetime.
Of
They
course.
always will remember that
Oh
and
yeah.
remember how they felt during that time.
Yeah.
So you
Yeah.
can't be like, oh, that was years ago, you're fine now. Or look,
Mhm.
your pregnancy is good. Don't worry about that one. You're good now. So you just have to acknowledge and let someone talk about, what
Yeah.
they're feeling.
Yeah. Yeah.
Because we don't talk about it enough.
We
It's like,
don't.
oh, yeah, you had a miscarriage, go home, rest, and then that's it.
And that's it. Sometimes I
Mhm.
remember, I had two choices because I had to travel, and they gave me the option to just, have it naturally come out or have surgery. And I opted to have surgery because I don't know how, I've never experienced it. I didn't have anybody. I felt ashamed. I felt all kinds of feelings. But at that
Mhm.
time, if I had sought help or maybe talked to a therapist or,
Yeah.
just sought help, maybe it'll give me a little more clarity as to what I was experiencing. But I
Yes,
just kept
yes.
it to myself and like, oh my God, what is this?
Mhm.
You just
Yeah,
have
yeah.
surgery to let you go and
That's it.
confused. You're just
Hmm.
lost.
Yeah, we have to do better at talking about that. And we have to, because like you were saying, this person had one, that person had one. It's so common. It's so common. But even though we know the numbers, we don't really have the support. There are some programs that are offered like pregnancy loss support,
Yeah.
but usually it's maybe for women who are further along in their pregnancy.
Right.
But anyone who has a loss should have that support.
That's I think it should be offered. Like, I don't remember anybody
Yes,
telling me,
yes,
hey, by the way, we have a counselor, or we have a
yes.
group, or we have a therapist, or are you open to talking to someone about this?
Mhm.
It's just like you're just done. You just like your thing, and then
Yeah.
you're gone. It's like,
And
and then
yeah,
you
that's
feel
it.
that,
We'll see you
the
next time.
nightmares. Yeah, I was having nightmares of visions of the lost baby, and
Mhm.
it's just never the same.
Yes, yes.
And you have a
It
baby.
stays. It stays with you.
Yeah, it can have flashbacks of, the
Mhm.
new baby. You have even some guilt, like you lost that
Oh
baby. Now
God, yes.
one,
That's
how.
a big, oh my God, that's a big one because everyone is always like, what did I do? What did I do for this to happen? What's
Right,
wrong with me? What's wrong with my body?
right.
And in most cases, we don't know, not to give that as an excuse to say that someone shouldn't feel a certain way, because it doesn't matter what we say as a
Mhm.
healthcare provider is not going to make the person go through it feel better, instantly. It takes time.
Absolutely.
But
Yeah.
there's always that, well, what if I did this? I had a mom that she worked in her pregnancy and had a loss, and we couldn't find out the cause. And
Mhm.
then when she got a new job and she became pregnant, she was like, I don't think I should work.
I
It was
know.
causing some anxiety for her. So she ended up working a little longer, and then she was able to take time off, but because she was with her partner, but still she said it was a big financial cut, but I just kept thinking about that.
Right. The guilt of what if it was because I was
Yeah.
adamant to work and that cost
Mhm.
a lot.
If I lifted something, I did this,
Yeah.
something I did caused this to happen.
It's so our last one will be on fibroids.
Oh,
Is it
yes.
true that fibroids are more common among we African American women, or
Yes.
is it like across board a very common thing
Is
that is
Yeah,
prevalent?
more common in Black women. We're
Mhm.
not even sure why the numbers are the way that they are. And one thing, and again, this is just through clinical practice, we're seeing it even in younger people, in their 20s, when before we used to not notice things until they were like in their 30s.
Right.
And because women would come in complaining of heavy bleeding, and there were women who suffer with heavy periods their whole lives.
I,
And then they realize they have fibroids all that time. So anytime I have a mom come in, I'm saying, Mom, a woman come in and she complains of heavy menstrual periods, like heavy flow lasting a week or 8 days. I'm always like, we got to check and evaluate to see if there are fibroids there.
right.
Fibroids could show up anywhere. And just to even back up, fibroids are growths on the uterus. They can happen anywhere in the uterus. They can cause the uterus to just grow significantly in size. I've seen women where their uterus is small, but they have several fibroids inside, but they're
Yeah.
just all small themselves, but
Right.
still enough to cause heavy bleeding. And
Right.
then I've seen women who, like there was one woman I examined who looked like she was 7 months pregnant. Her fibroid was so huge.
Wow.
And this woman, we ended up getting her help, but she didn't have insurance. She knew she had fibroids, but that's why it got to the extent that it had. And these
Yeah.
are solid mass. So can you
Yeah.
imagine? They're heavier than a baby in there.
Heavy.
Yeah. So, but she suffered. She ended up getting help. Thank God she ended up getting help. But still, she was suffering with heavy periods. But
Tons.
then it got so bad, she was bleeding almost the whole month.
Wow.
So,
Yeah.
but there's so many treatments that you
Yeah.
don't have to suffer
Yeah.
with them. There was one time they used to do just hysterectomies, and they
Right.
did more hysterectomies on Black women than
Mhm.
anyone else. So now that's not the treatment of choice. So
Yes.
yeah, so now there's so many treatments where they could remove them and still maintain the uterus. They do
Right.
that mostly for women who want to have pregnancies also. They try to
Right.
be very careful in how they remove the fibroids,
Yes.
because they really want to preserve so that a woman could have a pregnancy.
Oh,
They
yeah.
can lead to infertility too.
Oh, yeah. My
Mhm.
goodness. Yeah, my goodness. Even to jump off of that, looking back, my first baby, being that was such emergency, my fertility doctor, because I had to do fertility treatment for my second one, which took like over a year, if not more. was because of how aggressive they were when they were getting my daughter out because of an emergency. But if we were a little gentler with my lining and all of that, I wouldn't have had all that. And not to mention even like the use of birth control and how that can thin your lining, coupled with maybe previous emergencies in pregnancy. And then you start having infertility issues going forward. And it's very frustrating because you can't get the answers until somebody kind of takes a minute to say, oh, okay, it's from here, maybe it's from the surgery.
Yeah, and just to start with fibroids and to get into infertility, is one thing with fibroids is that I want women to know, if you're having heavy periods, heavy bleeding, you have to see someone. I've seen so much anemia, and that impacts all, your body and how you function, your energy levels. So if you don't get your fibroids taken care of or addressed, even being on birth control can help control the bleeding. It doesn't work for everyone with fibroids, but it's still better than having these heavy bleedings where, like, I had a friend that would say she stayed home because she was wear a tampon, a pad, and soaked through both of them. Soak through. She's like, I messed up so many chairs in my house that she don't want to go out. But her hemoglobin was so low that she would walk up the stairs. Yes. Yeah, very embarrassed. Like, even one time she was in a friend's car and her friend was like, you messed up my car. She was so embarrassed. But
it shouldn't be embarrassing. This help.
Yes, but please see someone if you have that. And then with infertility, what we're noticing, especially among the Black community, is we don't talk about it enough. And a lot of us suffer from infertility.
I'm gonna have to make a call sometime this year again to talk about infertility among African American women and how it impacts our mental health and how we
everything.
The shame that comes to it. Talk about endometriosis and how the diagnosis of it can sometimes takes a long time, and girls suffer in silence, or young ladies, and then
they don't know.
Yes.
Yeah, because even I remember when I was younger, I would have bad cramps. My mother would be like, "You're still getting up and going to school," and I'd be like, "Oh."
Yes,
I was like so much pain.
Spirit. Everybody has some pain, but if you're seeing your child, you're out there, you're suffering, it's out of, listen a minute, get her some help, get her a second opinion, a third opinion, even, don't let anybody dismiss what you're feeling. What you're feeling is legitimate.
Yes. And even with infertility, I know we're running out of time. I just want to say this last thing, because there is this myth that as Black women, we could pop babies out in a minute.
Right?
But that's not our situation, not for all women. So I always say to women, if you're having challenges, we say 6 months to a year. But even if you've been trying, you worry that there could be something going on, you don't have to wait a year of trying to get pregnant. You could always go in, get a consult, get blood work done. And insurance companies, before they wouldn't pay for it, now at least they're paying for part of the workup at least. Or somebody can get their workup done and that's covered, but then some of the treatments may not be. But even now, insurance companies are at least paying for half. I would like them to pay for everything.
That's good.
Yeah, that's where we need to go. We're not there yet, but just know that if you have concerns, there are providers that you could see that specialize in it. If your provider's being dismissive, say, no, you're young, when you're ready, you can have children, please talk to someone. I talked to a reproductive endocrinologist, and he said even women who want to delay having children should still talk with someone. If you're in your 30s and you're like, oh, maybe in my 40s I'll do it, talk with someone.
And freeze your eggs. There's so many ways.
Yes, so many things.
Didn't know
so many things
to do that. So on a final note, what would you say to someone listening to us, a young lady, maybe with a few of the things we've covered, to give them something in terms of our fertility when it relates to we women of color, especially? What would you say? Like,
I would say, trust your body. Know that you know your body. If you have a concern, talk to your provider. If you're pregnant, you have concerns, talk to your provider. they have a right to, you have the right for them to listen to you and answer your questions.
That is such a big point. That's a huge point.
Yes, because
You have the right for them to listen to you.
Yes. And that's whether you have insurance or not, you're seeing them. That's part of the relationship.
Yeah.
Is that I tell you what's going on. You go in and someone's telling you all the things that you need without asking you questions or even doing a physical assessment. So it's important for you to make sure that your concerns are being addressed.
Right.
If they're not, you don't have to stay in that relationship. Find another provider that's going to listen to you and provide care to you. And especially if you feel like there's something wrong, then trust your body. Your body's trying to say something is wrong. Yeah. Make sure that concern that they do that workup. They do a quick pregnancy test if you feel like there's something moving in you.
Right.
That your periods are heavy, let them do a quick hemoglobin to check. Or your legs are swollen and you're gaining weight and you're not eating. Say, something is not right. I'm worried about preeclampsia. Right. Is there anything else that you could do to make sure that I'm okay? So those are I just feel like you have that right. And if it could be very intimidating, or you go into a visit and someone's telling you things in another language. It's like I'm hoping to get my bathroom remodeled, and my contractor went with me to the place. They were talking a language I didn't understand.
Yeah, really.
But then when it's time to pay the money, I want to understand what's going on. Break it down for me in English.
Break it down. What are you talking about?
Yeah, so with our bodies, we have to do the same thing.
Yeah.
And you could always have somebody go with you.
Yeah.
Especially when you're pregnant, it's overwhelming. So have someone to go in and say, wait a minute, what are you trying to give her? Wait a minute, what's that blood test for? Or wait a minute, what do those results mean? Sometimes you need someone to help you to do that.
Think of it that way, but that's a really good point. Yeah, oh my God, thank you. So we can.
So much fun.
I know, it's so fun. It's like, I can't believe an hour, but we did it. Thank you so much for being on. Thank you for tuning in, people, and bring us any questions, any comments, any contributions. Like I always say, if you're able to whip it in your mind, if you ask the right questions, you're able to whip it every aspect of your life. It's all about speaking up, looking for the help, asking the questions, and seeking to ask the right people those questions to get your answers. But yeah, thank you so much. And I hope we can sit down again on a different topic soon.
Yes. Oh, I would love to come back.
Yes.
I would love to come back.
All right. Thank you. And God bless. Bye.
Thank you.
Bye-bye.
Okay.